गुड मॉर्निंग व्यूअर्स। एंड आज का एपिसोड मेरी चिट चैट का बहुत स्पेशल है, बहुत डिफरेंट है, क्योंकि आज हम किसी डिजीज़ या किसी प्रॉब्लम के बारे में बात नहीं कर रहे। आज हम बात कर रहे हैं कि रेसिडेंट डॉक्टर्स की जो लाइफ होती है वो कैसे स्ट्रेसफुल हो गई है इन दिनों। एंड टुडे वी हैव आवर ओन डॉक्टर मैत्रेय पाटिल टू स्पीक अबाउट इट। मैत्रेय, बिफोर हम ये सारी बातें करें कि हाउ द रेसिडेंसी हैज़ चेंज्ड और कैसे स्ट्रेसेस बढ़ गए हैं, या वॉट एवर इज़ योर पर्सपेक्टिव, योर्स मीन व्हेन आई से योर्स इट इज़ इन अ ब्रॉडर टर्म कि रेसिडेंट्स का या पोस्ट ग्रेजुएट डॉक्टर्स का। आई वॉन्ट यू टू इंट्रोड्यूस योर सेल्फ।
Hi, a very warm greetings to everyone and my friends. I'm Dr. Maitreya Patil from Mumbai itself. I just finished my residency about 6 months back from the Department of Orthopedics, and I'm working in Dr. Maitreya Patil Hospital as a senior resident right now.
वाह। सो मुझे ये बताओ कि इतने सारे ऑर्थो टॉपिक छोड़ के why you thought that this was close to your heart?
Ma'am, actually, I've come across a lot of my friends, my colleagues, and my juniors who have recently started developing a little bit of fear from the work environment and stressors they've been developed in lifestyle changes recently. So I just wanted to clear out a few facts and let them know how easy it is to overcome this stressful life and come across any kind of stressors available.
That's so nice. तो अगर हम लोग बात करें स्ट्रेस की, तो देखो रेसिडेंसी तो हम सब ने किया है, राइट? बहुत साल पहले आई डिड इट इन प्रोबेबली 1996, लेकिन और थोड़े स्ट्रेसेस तब थे। तो आजकल ये क्या बदल गया है विच यू फील विच एड्स टू द स्ट्रेस ऑफ पोस्ट ग्रेजुएट स्टूडेंट्स लाइफ?
Right, ma'am. Accordingly, what I felt was that right now the competition for NEET entrance exam has become so heavy. So the stressors in lives of postgraduate students have been carried forward immediately after the examination. So like basically, if we take for an instance any migratory student who has come from afar, from a different state to a city such as Mumbai, who is so overwhelmed with the everyday, like the fast metro life or whatever it is, they are not so adaptive very quickly. That's the only issue they face, and they just take time to get accustomed to the newer environment, the newer people, dealing with different professors and faculty and their colleagues. So it's all over a picture coming together, living away from home, and changes in life cycle and skipping of meals, which adds on and piles up to everything.
ऑल राइट, बट मुझे ऐसे लग रहा है मैत्रेय कि सो मेनी थिंग्स वर पर्टिनेंट दैट टाइम ऑल्सो। कैसा होता है रेसिडेंसी में, तो कोई पूछता नहीं कि आपने खाना खाया कि नहीं। तो वो तो आपको एक एंट्री लेवल पे जो हमारा काउंसलिंग होता है, या आजकल तो बहुत सारे रिफ्रेशर कोर्सेज, रिफ्रेशर नहीं बट एक आप लोग क्या कहते हैं उसको, कुछ कोर्सेज होते हैं ना, ओरिएंटेशन कोर्सेज। थैंक यू अमन। हाँ, ओरिएंटेशन कोर्सेज होते हैं, तो लोग कोशिश करते हैं कि आपको थोड़ा अडेप्ट कर दे। हमारे समय में ये सब भी लग्जरी नहीं था। तो मैं जानना चाहती हूँ कि आखिर इतना क्या बदल गया है ये 20 सालों में कि आजकल हम इतने स्टूडेंट्स देखते हैं जिनको स्ट्रेस रिलेटेड इश्यूज़ हैं, या जो ऑलरेडी साइकियाट्रिक मेडिसिन ले रहे हैं, या काइंड ऑफ थेरेपी पे हैं। What do you feel? What is your personal? I'm sure that you don't have experience, but तुम्हें क्या लगता है इसके बारे में?
Ma'am, actually what I felt was there was be lack of communication and planning before going, coming forth and performing any kind of task. So that's the only obstruction coming across finishing any person's work. So like in any new PG's life, like a postgraduate student's life, they are given a task of work and a few directives which they have to complete in a certain amount of time. So like unless and until they are completely directed as to how the work is to be done and what help they are required, and like in what time what should be done, and also different kinds of methods like changing shifts, working in shifts, such adaptive possibilities, if they come across that, I think that will act to a technical perspective to get work done and reduce the stresses.
Okay, so you feel that the working hours are
that is one of the
very aberrant, बहुत ज़्यादा है।
Precisely.
तुम्हें लगता है क्या कि तुम्हारा यूजी ट्रेनिंग या हम सबका जो यूजी ट्रेनिंग था वो एडिक्वेट था, हमको वो किस तरह से पीजी के लिए प्रिपेयर कर पाता है?
Ma'am, partially if you see from everyone's perspectives, it was adequate. मतलब हम लोगों को जो बताया गया था यूजी में वो कम्प्लीटली डिफरेंट था. कमिंग टू इंटर्नशिप वो पहला पड़ाव पार किया था.
करेक्ट.
एंड इंटर्नशिप ऑल्सो गिव्स यू अ स्मॉल पिक्चर कि हाउ अ रेसिडेंट्स लाइफ कैन गेट एंड हाउ टफ इट इज.
राइट.
Like it's not easy being in any first year residence shoes. Every one of us has gone through that, and now the stresses are rising because the pictures are getting bigger and bigger, and everyone's widening their perspectives of horizon.
मुझे ये बताओ कि क्या इसमें किसी भी तरह से फैमिली का स्ट्रेस इन्वॉल्व रहता है?
Yes ma'am, kind of. अगर मतलब if you ask me personally, if I didn't
No,
talk to
I
my
just want you to ask. हम जब भी कोई आंसर या क्वेश्चन करते हैं उसमें कुछ पोर्शन हम अपनी लाइफ का तो देते ही हैं. तो नोबडी कैन से कि मैं तो एकदम आउट ऑफ द वर्ल्ड. हम अपने एक्सपीरियंसेस ज़्यादा शेयर करते हैं. तो प्लीज़ बी फ्री टू आंसर.
Ma'am, so like it's very essential to talk to your parents while you're doing any kind of work throughout the day, because फिर ऐसा लगता है कि मतलब कोई आपके साथ है and you feel that emotional support which is very very essential.
सो यू फील कि जो बच्चे या जो स्टूडेंट्स अपने पेरेंट्स से कनेक्टेड फील करते हैं उनको ये रेसिडेंसी का स्ट्रेस जो है वो थोड़ा सा इजी हो जाता है उनके लिए?
Yes ma'am, precisely. Like if the parents are staying with the pupil or with the resident, I think उनको मतलब सब खाना टाइम पे मिलता है. whatever they need, they have to go buy something, they can just deliver them for them. And there's no such kind of issue where the resident has to leave his work and go. That is the main thing.
अच्छा, सो यू फील कि इतना ज़्यादा कॉम्पैक्ट शेड्यूल है कि अपने बेसिक चीज़ों के लिए भी शायद टाइम नहीं मिल पाता होगा?
मैम, आई वुडंट से टाइम नहीं मिलता, टाइम बनाना पड़ता है बिकॉज इट्स हाउ स्मार्ट यू वर्क एंड लाइक यू नो हाउ फास्टर.
बट देन एवरीबडी नीड नॉट बी दैट स्मार्ट. किसी को तो वही CBC और 5 चीज़ें ट्रेस करने को 10 मिनट लगता है और किसी को उसके लिए काफ़ी टाइम लग जाता है. तो इट इज़ फाइनली फाइंडिंग योर ओन सीमलेस पैटर्न. डू यू फील दैट द kind of department you enter also makes a difference? मतलब X department has more stress than Y department?
Ma'am, that keeps going on from department to department. Like for a general consideration, if you take pediatrics में you have a very small young child who can't even speak to you or communicate with you properly. So the skills of a pediatric resident would be more as they are prone to more stressors because they have to communicate with the parent and it's very stressful for them, you know, to know exactly what the etiology behind the disease causing agent is after the child. So it just keeps varying from department to department. Now, for instances, departments which don't have indoor patients, suppose like radiology, they face a different kind of stress as to how to finish so many ultrasonography patients in a day, and the number is in hundreds.
So it is. I can absolutely relate to that. Ki just the amount of number, and there is no way that we say, okay, this is it.
Yes,
it keeps on happening. 24/7 you are on call and you are always stressed.
Yes,
and आजकल थोड़ा मेडिकल लीगल इश्यूज भी आ गए हैं, तो you cannot. There is you don't want. You know you cannot even miss that one little thing.
Absolutely.
तो उसके लिए भी इतनी लड़ाई झगड़ा या डांट पीट जाती है, तो वो थोड़ा सा स्ट्रेसफुल. I absolutely now I can understand what you are actually trying to, where you are trying to get. And फिर JR1 JR2 तो बेचारे. Because what happens in the hierarchy, मेडिकल कॉलेज में कह लो या किसी भी इंस्टीट्यूट में कह लो, हायरार्की तो रहती है कि जिस तरह से हमने जो जूनियर मोस्ट काम करता है, सीनियर हैज़ वर्कड वन डे दैट वे ना, तो वो थोड़ा सा तो पुअर थिंग जो नीचे से आ रहे होते हैं उनको डेफिनेटली. नाउ कमिंग टू what are the red flag signs which you with your whatever research you did कि अगर रेसिडेंसी में ऐसा कुछ लगने लगे तो seek help?
Ma'am, firstly, any thought of like trying to end somebody's life firstly, and saying thoughts like I shouldn't exist here, maybe I stepped onto the wrong decision, I shouldn't have been here, that is the first red flag which we should seek. And get a person out of this image that why do they think like this, what is the main reason, to counteract that stuff. Then other effects such as loss of appetite, loss of sleep, excessive insomnia, or like loss of weight, these are a few things like breadcrumbs lying around here and there which we need to pick up and get the person out of it, and it's never too late to seek for help.
So do you feel that in residency having a good room partner makes a difference?
Yes ma'am, it thoroughly does.
So I would say, look, एक एनवायरनमेंट बाहर का है जो हम शायद नहीं बदल पाएंगे. इंडिया बीइंग सच अ वास्ट कंट्री एंड बहुत सारा स्ट्रेस रहता ही है काम का ख़त्म करने का, सबका है. इट इज़ वी कैन नॉट चेंज एवरीथिंग, बट लेट्स स्टार्ट फोकसिंग ओनली ऑन अ रेसिडेंट्स लाइफ. तो मुझे ऐसे लगता है कि हैविंग अ गुड पार्टनर, स्टॉप probably staying alone. When you, even if you return back for 20 minutes and you have somebody to talk to about some other thing, some other issues, or somebody who is more caring, could probably make a difference.
It makes a huge difference.
Maybe initially when you enter as a resident, उस समय शायद इतना नहीं पता रहता, but थोड़े दिन में पता चल जाता है इसके साथ मेरा जेल अच्छा होता है, तो फिर you can probably start at least spending little more time. And residency में unless until you are a room partner और कोई तरीका है नहीं ज़्यादा मिलने का.
अगर आपको 15 मिनट भी मिलते हैं खाना खाने के लिए, लंच खाने के लिए, and you sit with the person you are fond with and whom you can gel with the most. So communication is the key.
Fantastic.
Yes.
So I thought that at least we have found one little hope in this gloomy situation. कि एक पार्टनर हो जाए या एक ईटिंग जॉइंट हो या कोई ऐसी जगह हो जहाँ पे हम इस मोमेंट पे इस पर्सन से मिल सकेंगे, तो इट विल बी मच बेटर.
And once you start sharing your thoughts, your feelings and moments, that's the time you're coming out of it.
All right. What do you think that health problems तुम्हारे फ्रेंड्स में या रेसिडेंसी की वजह से हो जाती है? एक तो हमने साइकोलॉजिकल स्ट्रेस तो डेफिनेटली बात किया, एंड यू टच्ड समथिंग अबाउट सुसाइडल थॉट्स एंड नेगेटिविटी इन लाइफ की वेयर एम आई, मैं कहाँ फंस गया हूँ या फंस गई हूँ. बट वी विल टॉक अबाउट समथिंग फ्रॉम माई पर्सपेक्टिव लेटर ऑन, बट आई want you to speak about कि what are the problems which are faced due to stress.
Ma'am, firstly, there's loss of interest in everything. Like what you're trying to do. Like suppose you're doing residency in XYZ, you start feeling that okay, I'm not even interested in this. Like I don't like what I used to love doing earlier. That is the first main indication.
Hitting the reality.
Like coming to the picture. Where
yes, face to face with reality is very different.
Absolutely.
Yeah.
So that's the first thing which we come across.
Correct. I can understand because being a gynec, वो जितना डिज़ाइनर कॉन्फ्रेंसेस दिखते हैं, एक्चुअली जो रात हम स्पेंड करते हैं पेशेंट के साथ, दोज आर नॉट सो ग्लैमरस.
So the grass is always greener on the other side.
Agreed.
Nobody sees the background which all of us doctors come from.
So you feel that's the first thing. And बाकी की क्या issues हो जाते हैं health wise?
Yes ma'am. Ma'am, health wise you start losing appetite.
Okay, that's one.
Yeah, that's one thing because जब भी खाने का मन, when you don't get meals on time, that time भूख मर जाती है ऐसे लोग बोलते हैं. So like you don't feel like eating after that.
Correct. So, that I agree.
Yeah, that leads to loss of weight and reduced immunity naturally.
And
because we are not.
So many residents पहले तो ऐसे कहते थे tuberculosis के लिए teachers used to say start on high protein diet in residency so that you don't land up with tuberculosis.
Correct.
We all have
that,
heard this phrase.
Yes ma'am. And other thing is, like developing any kind of cosmetic issues like acne, dark circles, and loss of skin tone and all that stuff, glistening, glossy skin वगैरह कम होती है. So all these things are mainly related to loss of appetite, which reduced diet.
Alright.
And also like health issues which residents do face at most of the times are like any kind of
sleeplessness हो सकता है.
Yes ma'am.
Insomnia. I think that would be because you're constantly you have to do this, you have to reach. इतने बजे पहुंचना है, ये काम करना है, वो करना है. तो I think थोड़ा stress.
I read a study about like postgraduate students doing DM cardiology and all. They started suffering from palpitations and tachypnea because worrying about the patients throughout their day, and even like they have sleepless nights. Their task is like next to God's task because they have to monitor the patient throughout. Like super specialty in cardiology is not easy. It's a very difficult task. And similar things goes with.
It used to be same said about CVTS also.
Yes,
long time
yes.
back because surgery 8-10 घंटे, उसके बाद और 24 घंटे बैठना. Yes. And if at all by that time you have a family and then all those pressures because your wife wants you or your spouse wants you to be there.
Yes, ma'am.
You just cannot be there, but those are the things which come as a package.
Yes,
because you are such a big doctor, then you have to sacrifice a lot. It is not so simple and it's not so glamorous how it looks like.
Agree.
अगर किसी को stress हो मैत्रेय, somebody is actually having stress and is watching this video, what are the few things which you feel कि इतना तो तुम कर लो and you will be probably at a better zone?
Okay. Ma'am, I think like they should try to take a gap from the work, like at least for a day or two, and give time to themselves and the people they are fond the most. Like do what you used to love earlier. Like you want to go out, get some fresh air, go for walks, have a good meal of whatever they like. Even if it is junk food, it's gonna get burned up
Yes.
because you have to run around a lot.
Agreed.
And do what you like basically. And communication is the key, followed by a proper planning with teammates and teamwork and execution of the work.
I think building a very strong relation inside the department
Yes.
also makes
It makes a huge
a
difference.
huge difference because finally तो it's like your family ना.
Yeah,
तो
definitely.
थोड़ा फैमिली में भी ups and downs होते
होते
हैं.
हैं.
तो अगर उसको इतना हम zoom in करके उसको इतना बड़ा ना बना दें and we have a good cordial relation, and then आजकल administrators are very sensitive in
Yeah,
medical
they are.
colleges. We have
Particularly
counselors in
yeah.
place, we
Yes.
have administrators who understand these issues. हमारे समय में मुझे कोई बोलेगा डिप्रेशन हो रहा है तो मैं बोलूँगी what is depression, but today we acknowledge that yes, it
yes.
is. Because probably the population coming to the hospital has also increased.
Absolutely.
People are
Yes.
in metros running the OPD
Yes.
and the work is definitely very high.
And people have become so aware about the fact, and people know about it, and then they approach help very easily. At our hospital, we have a fantastic facility, and faculty of the departments of psychiatry and everything are there. Just so good with their work, so we can tackle this problem very easily now and
Correct.
get over
So
it.
approach the thing. Help is
Yes,
there,
ma'am.
provided you acknowledge and you start
Yes, ma'am. Absolutely.
approaching people.
Yes,
So
yes.
they are there to help you.
Always.
Do you feel that probably getting a good friend circle even in residency makes a difference? With new technology, it can add to your stress.
Yes, ma'am.
अब आजकल तो फेसबुक पे लाइक नहीं मिला तो भी स्ट्रेस हो जाता है, इंस्टा पे लाइक नहीं मिला तो स्ट्रेस हो जाता है.
Yes.
तो डू यू फील दैट ऑल दिस सोशल मीडिया इज इंक्रीजिंग द स्ट्रेस ऑफ रेसिडेंट्स आल्सो?
Ma'am, it has its perks and cons both, if you ask me. Like, if I used to get stressed, I used to go on social media and laugh on the reels and memes, whatever used to come up. And other thing is, like, as you said earlier, like your colleagues and everyone in the department, they become your family. So friends becoming family over the span of 3 years is what highlights residency. For people coming out of depression and everything else, they really get fond about this.
Right.
That's what I've observed.
Also, I need to, as a very senior teacher, if I have one advice, I would say कि ये जो 3 साल मिले हैं ना हमको रेसिडेंसी के, ये बहुत कम होते हैं. 3 साल की स्टडी में हमें इतनी नॉलेज हो जानी चाहिए कि हम अपनी पूरी ज़िंदगी जिस भी फील्ड में आप स्पेशलिटी कर रहे हो वो ट्रीट कर पाओ विथ रीजनेबल, नॉट एट 100%, लेकिन एटलीस्ट हाई रिस्क चीज़ें एक्नॉलेज करना, उनको प्रॉपरली रेफर करना. तो every moment is important. That's why the training program is so strict that in 3 years we have really produced very, very good doctors. But that doesn't mean you work hard and you party harder, because only then you can really, that interpersonal and these little outings, little parties, little picnics, which whatever possible, बहुत ज़्यादा नहीं हो पाता लेकिन ये बहुत ज़रूरी भी है.
Yes, ma'am. Yeah.
A lot of friendship happens over that pizza which you have ordered at रात के 7 बजे, 8 बजे, 9
Yes,
बजे.
that is the
So it is
truth,
very
yeah.
important to keep the relations and this thing. We will not be able to change the whole environment, but seeking help, acknowledging that I'm not feeling all right,
Yeah.
connecting to your family, just
Yes.
giving one call to your mom,
Yeah.
listening
These are the
to
key
her.
points,
These
yeah.
are the key points.
Absolutely.
Anything beyond this, Maitreya, if you wish to tell our viewers and your resident friends who are
Guys,
watching this.
Like, to be very honest, like all of us have gone through this. It's a part and parcel of life. And once you come across, like once you're done with residency, you just ponder upon the memories and friends you've made and how beautiful the life was in those 3 years. And it reaches another level of, admiration. Ki, oh wow, I have come across this and this is the new milestone I've achieved. And later on, you just keep developing more and more in life, and you still ponder over those memories and go back and cherish them. So you just make sure you have fun, be sincere, and put a lot of efforts, because this is gonna stay back throughout your life. And you're gonna, as ma'am said earlier, you're gonna learn the most throughout this. You're gonna work the most, and whatever you work in your first year and grasp whatever, it's gonna stay with you for a lifelong. to just have fun. Yeah.
Thank you so much, Maitreya. I
Thank
promise
you.
that we'll again catch up on some different aspect of residency with you. It'll be such a pleasure talking to you once again.
Thank you.
Thanks a lot. Thank you
I'm
so
really
much.
Thankful for you for getting me on this stage.
Oh,
today.
it was my absolute
Thank
pleasure.
you so
It was
much.
absolute
It was really
pleasure.
great talking.
Thank you so
Thank you.
much.